Diabetes is one of the most prevalent chronic conditions globally, affecting millions of people. It is a metabolic disease that causes high blood sugar levels, either because the body does not produce enough insulin or because the cells do not respond properly to the insulin produced. In this script, we will explore the causes of diabetes, the different types of the disease, and ways to prevent its onset. Whether you are at risk or simply interested in learning more, understanding diabetes is crucial to managing and preventing it. Diabetes occurs when the body's ability to regulate blood sugar is compromised. Normally, the pancreas releases insulin, a hormone that helps cells absorb glucose from the blood to be used for energy. However, in people with diabetes, either the pancreas doesn't produce enough insulin or the body's cells don't respond well to it. This causes a buildup of glucose in the blood, which can lead to various health problems. Understanding how the body processes glucose is essential to grasp the complexities of diabetes. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. It is usually diagnosed in children and young adults. It results from the body becoming resistant to insulin or when the pancreas cannot produce enough insulin to maintain normal blood sugar levels.
The causes of type 1 diabetes.
The exact cause of type 1 diabetes is not fully understood. However, it is believed to be triggered by genetic factors combined with an environmental factor such as a viral infection. In people with a genetic predisposition, certain infections may trigger an autoimmune response that attacks the beta cells in the pancreas, leading to insulin deficiency. Although type 1 diabetes is rare, its impact can be devastating, requiring people to take insulin for the rest of their lives.
The causes of type 2 diabetes.
Type 2 diabetes, which accounts for the vast majority of diabetes cases, is primarily caused by lifestyle factors. Obesity, lack of physical activity, poor diet, and smoking are significant risk factors for developing type 2 diabetes. Additionally, genetics also play a role in determining whether someone is more likely to develop the disease. When the body becomes resistant to insulin or can no longer produce enough insulin, blood sugar levels rise, leading to the symptoms of type 2 diabetes.
Risk factors for type 2 diabetes.
Several factors increase the risk of developing type 2 diabetes. These include being overweight or obese, having a sedentary lifestyle, and consuming a high-calorie, low-nutrient diet. Age is also a factor, as the risk of type 2 diabetes increases after the age of 45. People with a family history of diabetes, high blood pressure, or high cholesterol are also at an increased risk. Women who have had gestational diabetes during pregnancy are also more likely to develop type 2 diabetes later in life.
Symptoms of diabetes.
Common symptoms of both types of diabetes include frequent urination, excessive thirst, increased hunger, fatigue, blurred vision, slow healing sores, and unexplained weight loss. While type 1 diabetes typically develops rapidly, the symptoms of type 2 diabetes can develop slowly over several years. Many people with type 2 diabetes may not experience symptoms until significant damage to the body has already occurred. That is why regular screening for diabetes is essential, especially for those at risk.
Complications of untreated diabetes.
If left untreated, diabetes can lead to serious complications, such as heart disease, kidney failure, nerve damage, blindness, and stroke. High blood sugar can damage blood vessels and nerves, impairing the body's ability to heal wounds and increasing the risk of infections. The longer someone lives with uncontrolled diabetes, the higher their risk for these complications. That is why it is crucial for people with diabetes to manage their blood sugar levels and adhere to treatment plans.
How to diagnose diabetes.
Diagnosing diabetes involves a blood test to measure the level of glucose in the blood. The most common tests include the fasting blood sugar test, the oral glucose tolerance test, and the hemoglobin A1C test. The A1C test is particularly helpful in diagnosing type 2 diabetes as it measures the average blood sugar levels over the past 2 to 3 months. Early diagnosis is key to preventing complications and managing the disease effectively.
Lifestyle changes to prevent type 2 diabetes.
The best way to prevent type 2 diabetes is through lifestyle changes that help manage weight and improve overall health. Regular physical activity such as walking, jogging, swimming, or cycling can help lower blood sugar levels and increase insulin sensitivity. A healthy diet rich in fruits, vegetables, lean proteins, and whole grains can also help manage weight and prevent diabetes. Avoiding sugary foods and drinks, processed foods, and refined carbohydrates is essential in preventing type 2 diabetes.
The role of physical activity in prevention.
Physical activity is one of the most effective ways to prevent and manage type 2 diabetes. Regular exercise helps the body use insulin more effectively, allowing glucose to enter cells and be used as energy. In addition to improving blood sugar control, exercise also helps reduce the risk of obesity, heart disease, and high blood pressure, all of which are linked to diabetes. Experts recommend at least 150 minutes of moderate intensity exercise per week for adults to help prevent type 2 diabetes.
Importance of weight management.
Maintaining a healthy weight is crucial for preventing type 2 diabetes. Excess fat, especially abdominal fat, can cause the body to become resistant to insulin. Losing even a small amount of weight, around 5 to 10% of your total body weight, can significantly reduce your risk of developing diabetes. Weight loss helps improve insulin sensitivity, lower blood sugar levels, and reduce the strain on the body's organs and systems. A balanced diet and regular exercise are key to achieving and maintaining a healthy weight.
Healthy eating for diabetes prevention.
A healthy, balanced diet plays a major role in preventing and managing diabetes. Eating foods that are low in sugar and high in fiber, such as vegetables, fruits, and whole grains, can help maintain blood sugar levels. Foods that are rich in healthy fats such as olive oil, nuts, and seeds can also help regulate insulin levels. It's important to avoid processed and refined foods, which can lead to weight gain and spikes in blood sugar levels. Portion control is also essential for managing blood sugar.
The role of insulin in diabetes.
Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. In type 1 diabetes, the body is unable to produce insulin, and people must take insulin injections or use an insulin pump. In type 2 diabetes, the body becomes resistant to insulin, and the pancreas cannot produce enough to compensate. Insulin therapy helps regulate blood sugar levels and prevent complications. People with type 1 diabetes will require insulin for life, while those with type 2 may need it as the disease progresses.
Medications for type 2 diabetes.
In addition to lifestyle changes, people with type 2 diabetes may need medications to help manage blood sugar levels. Oral medications such as metformin work by improving the body's sensitivity to insulin and reducing the amount of glucose produced by the liver. Other medications may be used to stimulate the pancreas to produce more insulin or help the body use insulin more effectively. In some cases, people with type 2 diabetes may need insulin injections to help regulate their blood sugar levels.
Managing stress and diabetes.
Stress can have a significant impact on blood sugar levels, making it harder to manage diabetes. When the body is under stress, it releases hormones like cortisol and adrenaline, which can raise blood sugar levels. Learning to manage stress through relaxation techniques, meditation, yoga, or deep breathing exercises can help prevent spikes in blood sugar. Maintaining a healthy work-life balance and engaging in activities that bring joy and relaxation are important for overall well-being and diabetes management.
The impact of sleep on diabetes.
Sleep plays a critical role in managing diabetes. Poor sleep quality or insufficient sleep can disrupt the body's ability to regulate blood sugar levels. People with diabetes are more likely to have sleep problems such as sleep apnea, which can further worsen their condition. Establishing a regular sleep schedule, creating a relaxing bedtime routine, and avoiding stimulants like caffeine before bedtime can help improve sleep quality. Adequate sleep helps regulate hormones that control hunger and metabolism, supporting overall diabetes management.
The role of support networks in diabetes management.
Managing diabetes can be challenging. but having a strong support network can make a significant difference. Support from family, friends, and healthcare professionals can help individuals with diabetes stick to their treatment plans and stay motivated. Joining a diabetes support group can provide valuable emotional support and practical advice for managing the disease. People with diabetes can also benefit from education programs that teach them how to monitor blood sugar, administer insulin, and make healthier lifestyle choices.
Diabetes in children.
While type 1 diabetes is more common in children, type 2 diabetes is becoming increasingly prevalent among children and adolescents, primarily due to rising obesity rates. Children with type 1 diabetes need insulin therapy to manage their blood sugar levels, while children with type 2 diabetes can often manage the disease through lifestyle changes such as diet and exercise. Early diagnosis and intervention are critical for preventing complications in children with diabetes.
Gestational diabetes and its impact.
Gestational diabetes is a type of diabetes that occurs during pregnancy and typically goes away after childbirth. However, women who have had gestational diabetes are at an increased risk of developing type 2 diabetes later in life. Gestational diabetes can affect both the mother and the baby, increasing the risk of complications during pregnancy and delivery. Women who have had gestational diabetes should undergo regular monitoring for type 2 diabetes in the years following childbirth.
Conclusion and prevention tips.
In conclusion, diabetes is a serious and widespread disease, but it is also preventable through healthy lifestyle choices. Maintaining a balanced diet, staying active, managing stress, and getting enough sleep are essential steps in reducing the risk of developing type 2 diabetes. For those with type 1 diabetes, insulin therapy is essential for managing blood sugar levels. Early diagnosis and regular monitoring of blood sugar levels can help prevent complications. By making these changes, individuals can take control of their health and reduce their risk of diabetes. For more amazing content on everything from entertainment to lifestyle, make sure to subscribe, hit the like button if you enjoyed this video, and share your thoughts in the comments. Don't forget to share with your friends so they can enjoy too.